And I must say, as I stood there in my new capacity as the Ash, I said to myself, this is not an accident, this is somehow destiny. So we are building this new infrastructure, as you can see. We are promoting stronger primary care and supporting providers who care for disadvantaged populations, and this is where the leadership of Mary Wakefield and Yvette Rubidoux has been absolutely tremendous, and we are very proud to announce that as part of already the accomplishments of this new administration. Second, with respect to ensuring access to health care, we will pass health reform soon with your support. Thank you. And we will do it for many, many, many reasons. I have lived through the frustration of working in this non-system as a clinician myself. But what touched me the most and what touched the country the most, perhaps, was when the President read from the letter from former Senator Edward Kennedy that, quote, "What we face is above all a moral issue. At stake are not just the details of policy, but fundamental principles of social justice and the character of our country." That's what this debate is all about. And we have the opportunity in health reform not just to improve access, but also, again, to promote wellness and prevention. There are provisions both on the House and Senate sides about improving preventive services, hopefully getting trust funds dedicated to prevention and wellness. It's also a great opportunity for us as we embark on Healthy People 2020 to get your active input about how to make our nation healthier in the future. Thank you. Just this past Saturday, we had our second national public meeting on Healthy People 2020 here in Philadelphia. Many of you participated, and you know that Healthy People is a process where we set forth a vision for the entire country, a vision that hopefully will touch every life in the U.S., a vision of true public health and wellness for all. And the Healthy People 2020 framework has 4 overarching goals: to attain high-quality, longer lives, free of preventable disease, disability, injury, and premature death, to achieve health equity and eliminate disparities, to create social and physical environments that promote good health for all, and promote quality of life, healthy development, and healthy behaviors across all life stages. That's what we're trying to do in public health. And listen to this beautiful language that's part of our Healthy People documents as we move forward in this national planning process. Quote, "Over the next decade, Healthy People must inspire with the spirit of its reach, encourage with its sense of the possible, compel actions by policymakers, professionals, and community members at multiple levels of society, highlight the determinants of health, and lay bare the unacceptable." I love that last line, lay bare the unacceptable. That's what we're trying to do with Healthy People. Thank you. For overarching priority number 3, eliminating health disparities and achieving health equity, we want to work with APHA once again. And I am very proud that our Minority Health Office has engaged in a 2-year process of planning to build a national partnership for action to end health disparities. There are 5 elements to this rollout now that we are galvanizing around to increase awareness, enhance patient-provider communication, improve cultural and linguistic competency in delivering health services, coordinating and utilizing research and outcomes evaluation more effectively, and they call it research because you search over and over and over again. And 5th, and most important of all, strengthening leadership. Strengthening leadership, defined by Kouzes and Posner as, quote, "the art of mobilizing others to want to struggle for shared aspirations." Everybody here is a community leader in public health, and we can talk either implicitly or explicitly about what that leadership entails. But hear this beautiful poem from Lao Tzu, a Chinese philosopher who wrote one of the most beautiful lines about community leadership I ever read. Quote, "Go to the people, live with them, learn from them, love them, start with what they know, build with what they have, but with the best leaders, when the work is done, the task accomplished, the people will say, 'We have done this ourselves.'" That's what we do. Thank you. When we develop a true public health system in the future, with your help and leadership, we will have quality measures. And a discussion on quality with APHA and Georges Benjamin is something that I treasure and support fully. There's been a lot of efforts to define the dimensions of public health quality as well as healthcare quality. So I look forward to advancing that conversation with you. And at our Office of the Assistant Secretary of Health, we've just established a new Office of Healthcare Quality that I hope can also advance this conversation to help all people reach their highest attainable standard for health. So in closing, thank you so much for staying to the end. Thank you so much for your service to society. Thank you very much for your inspiration and your passion and compassion. And I love those words because inspiration comes from the words to breathe life. Passion comes from the word to suffer. And compassion, as you know, means to suffer with. And that's what we do in public health. So my final quote as I end here is from Martin Luther King, who talks about our service and your service and about public health. Reverend King once wrote, quote, "Everybody can be great because anybody can serve. You don't have to have a college degree to serve. You don't have to make your subject and verb agree to serve. You only need a heart full of grace and a soul generated by love." Thank you for your service to the United States. Thank you very much. Thank you.